So you've had your baby and things are not filled with rainbows and butterflies like you thought. You're sleep deprived, hormonal, recovering, and trying to be a good partner and mother. Your balancing act feels like it could fall at any moment. How do you know if it's just a temporary baby blues or something more serious? I'm Dr. Katie Hurst, Director of Maternal Mental Health at UC San Diego and Education Coordinator of the Postpartum Health Alliance. I'm here to talk with you about postpartum depression, and this is Parent Savers, episode 24.
Faster than a speeding toddler.
Sit still for just a minute.
Can soothe boo-boos with a gentle kiss.
Would you get down from there?
Able to clean poopy bottoms in a single swipe.
Oh, what did you eat?
Turning frazzled mommies and daddies into procreators of peace and harmony.
Ah, quit touching me.
It's Parent Savers, empowering new parents everywhere.
Welcome to Parent Savers, broadcasting from the Birth Education Center of San Diego. I am your host, Casey Wilt. You can now download our free app. How cool is that? So check it out on your smartphone or tablet, or visit our website, parentsavers.com, for more info. We also want you to be a part of the show. If you have a question in an episode that we didn't answer, send it in. You can email one of our experts directly and ask your parenting questions. You can send us a message on the episode online through Facebook, email, or you can call our hotline and we'll get them answered. We're also so excited to announce the Parent Savers Club. This is an exclusive membership club available to all of our listeners. It gives you access to all the archived episodes, written transcripts of the show, plus a special monthly newsletter with special giveaways, discounts, and much more. You can access all this great information through the web or through our Parent Savers app. For more information, visit the website, parentsavers.com, and click on the members link at the top of the page. I am a new parent myself. My son Carson is now 22 months old, and I'm joined by two new parents here in the studio.
Hi, everyone. I'm Sunny Galt. I am the host and producer of Parent Savers' sister show, Preggy Pals. I have two little boys. One is just about 2 years old, and one is about 5 months old.
My name is Rachel Rainbolt. I am 29 years old. I am a parent educator and author of the Sage Parenting book, and I have three wonderful boys. They are 7, 4, and 9 months yesterday.
Aw, he's growing up.
And it sounds like you have a lot of wrestling in your house.
We call them rambunctious hugs.
Before we begin today's show, here's a parenting oops. It's a new segment we've started, and I want to share an oops that I had. Actually, I have a lot of oops. But there was one week in particular, gosh, my son was a few months back, and my husband wanted to hire a nanny for me because he didn't trust me.
Wait, weren't you a nanny at one point, too?
Yes, exactly. He was going to hire someone because every single day he came home and goes, what in the world did our son do? So here I am talking to my sister-in-law on the phone, and Carson, my son, is playing in the safe cupboard in the kitchen. And so he's playing with this big plastic thing. The whole thing is plastic. And it's a little chopper for onions or whatever. Well, in this whole big old, 12 inches by 4 inches long, 4 inches wide, 12 inches long. There is maybe a 3-inch by 3-inch segment of blades.
Oh, no.
and just right for little fingers to fit through because it's to chop your onions. So here I am talking to my sister-in-law, and he's playing with it, and I'm watching him. And there's a little plastic thing that goes on and off of it, and it's all plastic, mind you. And all of a sudden I see blood, and I'm like, what in the world? And he doesn't notice it at all. And there's blood everywhere because it's like a paper cut everywhere. So he's just going on, and then I, quickly get off the phone, and then I try to put Band-Aids on my son because the blood doesn't stop going. Oh gosh. And then I think the next day he fell down the stairs head first, and then up the stairs, and then, somewhere around there he probably opened the door and ran out in the street. So that's probably why my husband wanted to hire a nanny. So, that's my oops, and I'm sure I will be sharing more oops with you guys in the future. So if you have a parenting oops you'd like to share with our audience, call the Parent Savers hotline at 619-866-4775, and we'll include your oops in a future episode. Today on Parent Savers, we have Dr. Katie Hurst here to talk to us about postpartum depression. Dr. Hurst, what is postpartum depression?
Well, I think it's actually important to know, first of all, that postpartum depression can actually start in pregnancy. And so I think in our culture, we talk a lot about depression that really only starts after the baby comes. But it's also important to know that a lot of moms who are pregnant can be depressed. And it's hard when we only talk about postpartum depression because women have this idea that they're supposed to be full of joy and completely happy the entire pregnancy. And there are a lot of moms out there who also feeling depressed during their pregnancy. But postpartum depression and pregnancy depression are basically a depressive episode. It's when women feel sad or they feel like they can't enjoy things the way that they used to. They commonly feel really guilty. So I'll see women who feel incredibly guilty that they're not reading to their 4-week-old enough. And really, when you think about it, like a 4-week-old, you don't have to read to them because they're 4 weeks old. They feel like they're worried all the time about something that's going to go wrong. They don't have any energy. And yeah, when you have a new baby, you don't have very much energy, but it's even more profound than that. They also feel like they have trouble sleeping. So it's not just the problems where your baby's waking you up in the middle of the night. It's not being able to sleep, even when it's nighttime, the house is dark and quiet, baby's asleep, still not being able to fall asleep because your mind is just going, worrying about things, or worrying when is the baby going to wake up, how am I going to feed the baby, things like that.
So a lot of anxiety.
Exactly. That's a very common feature of postpartum depression.
And what are some of the risk factors that are tied to postpartum depression? Like, how would women know, that they had it or, have a history of it or something like that?
Well, I think that women going into pregnancy and having a baby, the most important risk factor is actually whether or not you've had depression in the past yourself. So women who have had depression at any point before in their lives, whether they needed medication or needed therapy or even kind of just stuck it out and got through without any treatment, that gives you about a 25% chance of having a depressive episode after having a baby. Women who have any depressive symptoms, even if they don't have a full-on depression, just feeling more tearful than usual, feeling sad during pregnancy on a regular basis, that gives you about a 30% chance of going into a full-on depression postpartum. And another really important factor is that there are a lot of women who in their 20s or 30s have their first episode of depression before pregnancy. And if they're treated with medications, we've got a very good study done a few years ago that shows that women who were on medications for a past depression and doing really well, good mood, feeling great, and then got pregnant and stopped their medicines, those women actually had a 70% chance of becoming depressed again during pregnancy and going into postpartum. So really a lot of this is history, what's going on in your past and what's been going on recently. But along with all of that personal history, it's also a family history. Has anybody in your family, mom or sister, had a postpartum depression or anxiety? And then I think, personal stressors. So having a major life change, certainly moving across the country like I've had some women do, being away from your support network,
or just having a baby is a life change.
One would say, yes, having a baby. Exactly. So, it's a lot of the things you could think of that major life changes. Having a baby is a major life change. Not having social support is also a really good predictor as well.
And how soon after having a baby should you start looking for those symptoms and being sensitive to what's going on inside you?
Well, it's a good question because we talk about the baby blues and then we talk about depression. And the baby blues happen to 80 to 90% of women. And this really is a reaction to the big hormonal change that happens within 24 hours of delivery. So after you deliver your placenta, your progesterone and estrogen levels, which are the main hormone levels in your body during pregnancy, go from sky high to so low that it's like you're postmenopausal. And they stay that low as long as you're breastfeeding and not getting your period. And so that sudden change that happens within 24 hours after delivery, you can imagine kind of disrupts your brain a bit, along with the sleep disruption. You've just had a baby. Everything that's gone on really makes women tearful, more irritable. I remember after I had both of my girls, finding myself just crying for no reason for a couple hours at a time. And that was within those first couple of weeks. So that's really normal, and that's experienced by most women. It's when something like that continues past 2 weeks or starts after 2 weeks postpartum that we start to get concerned. So really, you can have it anything that comes on within the first year we can talk about as being postpartum depression. And in reality, I think moms with children of any age can get depression. And we really just need to acknowledge that that's something that happens and that it's not something to be ashamed about.
And what triggers it? What could bring it on?
Well, for some women, it seems that there's a sensitivity to hormone change. So women who have really bad PMS seem to be at higher risk for having really significant postpartum depression because you have big hormone changes before you get your period and you have big hormone changes after you deliver. And so that seems to trigger some sort of depression. But beyond the hormonal change, there's also all the other things that go along with having a baby. So you're not sleeping, you're completely stressed out because there's this new person outside of you that you're trying to love and care for, and all the other responsibilities that come along with that. So beyond just the hormonal change, there's the new responsibilities that come, the obligation that comes with that, and just the anxiety and stress that can bring up.
Well, it's interesting. I had right after the baby's born, I feel like I was inundated, actually before the baby was born, with literature, pamphlets. Are you depressed? Are you this? And then people asking you, are you depressed? And to be honest, I had a traumatic labor and birth and delivering my baby, was in the NICU and everything. And I had post-traumatic stress. I would get in the car, and if we played the same CD, that when I was going to the birthing center, I'd start to panic or have anxiety. When I had to go do my 2-week checkup at where I gave birth, same thing started. In fact, actually right now, thinking about it, my arm hair is going up. Just getting all just panicked or whatever. And so it was interesting because then they'd ask me these questions at the doctors. Do you feel this? Do you feel this? No, I don't. Do you feel this? Do you feel that? No, I don't. And feeling fine. And then, of course, I made steps to heal from my traumatic birth. I know we've met with a counselor and stuff. But now my son is 22 months old, and I feel at like 15 months and at like 21 months, I have had these weeks, this week in 1 month, and I'm totally down. I'm totally out. We've gone swimming, and my son can swim really well. But he's 22 months, and I have to help him to the side or whatever. And I remember one time being like, if he drowns, it could be an accident. That's not normal. And that's not normal thinking, and totally scares me. Now, I would never, I know me, and I couldn't ever get to that point of harming my child or anything, or watching him drown per se. But I didn't like those feelings that came in, and I was shocked because it was 15 months and 21 months, and it was just for a week, and then I started taking maybe being regular with my prenatals, or being regular with something or else, and then I would just be fine. Is that normal? I mean, how long does this postpartum last? And can it be intermittent? Can it be a week here or a week there? Or is that not postpartum? Is that something classified as something else?
Well, I think that's where this term of postpartum depression, which is not kind of an official label within psychiatry, that's really kind of our cultural term for feeling sad and depressed after you have a baby. And this whole idea of there's only a specific time period in which you're allowed to get postpartum depression and kind of that's it. That's not really true. Women can have periods of feeling more anxious or feeling sad or being depressed at any point in their lives. And when we're in our 20s and 30s, when we're having kids, is the same time when we're more prone to start having episodes of depression or anxiety. And certainly, I see a lot of problems come up when women, they can get into a routine of taking care of their children, feel like they're doing really well, and then a big change hits or a big stressor hits. And suddenly they don't have what they need to cope with that big change or stressor. And so their mood can start to get lower. They can start worrying a lot more. And that could be the beginning of a depression, could be the beginning of an anxiety disorder. And it sounds like you were able, Casey, to kind of hit it off at the pass. You were able to stop it by launching into all the self-care that you really needed to do, hopefully by asking for help, by realizing, okay, this is not good. I need to do something about this. I think it's when women slowly fall into the pattern of feeling bad about themselves, questioning their ability to mother, all those things that come along with depression when you're a mom, and they don't realize it. They start to kind of think, oh, this is just normal. This is just kind of how I am now. And I see women who have been feeling like this for months, and that's the depression. That's really where they haven't kind of realized that they're sinking lower and lower, and they get to the point where they really need formal treatment. So counseling, medicine, which I know we'll talk about later. But that self-care, it sounds like you kind of realized what was going on and hit it.
Well, I think it's funny because at 15 months I didn't recognize it, and at 21 months, and actually I talked to somebody, and she told me, yeah, after a year you can totally get bummed out and everything else. And so when at 21 months with the swimming episode, I recognize as this is not normal. One, I knew that wasn't normal, but you think horrible thoughts, in the middle of the night when your baby's, waking you up, and you don't that's not necessarily that's depression that's being woken up.
I mean, it's 3 a.m.
That's being grouchy, really. So I recognized that wasn't at the 21, but it took me someone telling me that it's okay when they're older to do it, and then it took me to realize this is not normal thoughts. I love my son and I adore him. Why would I want a life without him? Even for that brief moment, why would I ever
it's disturbing to think that as a parent. It's like, how did I let myself go to that? And I'm like you, Casey. And it's not, honestly, it wasn't for me like just a week. It's random thoughts here and there. But it's not all the time. Mm-hmm. It's just like when I get to a point that I'm just like, oh my gosh, I don't even know if I could take this anymore. Then these thoughts, like the swimming idea, is just like, all I have to do is walk away. Problem solved. And then you're like, oh my God, what? I'm a horrible parent. What the heck am I thinking? Like, there must be something wrong with me. So, I mean, I guess my question is, what are some of the warning signs? And we've talked about some of these already, but, for women out there, like, gosh, is this postpartum depression or not? What are some clear warning signs that you would give moms to say, if you do this, maybe you should, maybe that's what this is?
Well, I think the two of you are talking about something that one of my favorite blog writers called mommy visions, which is this kind of what in psychiatry we call it an intrusive thought or an intrusive image, because it literally intrudes on your mind, comes out of nowhere, of either picturing something bad happening to your child or thinking that, okay, if this happens, I'd be okay, or thinking what would happen if he fell down all the stairs and something bad happened. And that's actually, I'm gonna back up and say, when you first deliver, I think it's very normal for even women who are totally healthy emotionally to have one or two of those images pop into their mind of carrying a newborn baby, dropping the baby on the floor, something bad like that happening. And if you're in a healthy state of mind emotionally, you have that thought and you kind of go, oh, that was really terrible. Nothing like that. I hope never happens. You brush it off and it goes away. If you are more prone to depression or already kind of an anxious person, that thought's going to come in. And just like you said, Sunny, you're going to think, oh my gosh, I'm a terrible mother. What does that mean? And it's going to kind of keep hitting you, and it's going to almost stick to your brain and keep coming back.
The bad thought or
that bad thought?
Okay.
That thought of, well, first of all, this means I'm a bad mom. And second of all, this vision of something bad happening to your child or the thought of something bad. And I feel like when you start experiencing those thoughts over and over again repetitively, that's when you need to seek help. Because really having that kind of thought daily or a few times a day signals to me that there's something going on that in your brain that's allowing those to come on over and over again. And it's also really distressing. I can only imagine what it's like to picture something bad happening to your child. I mean, that really sets you up to not feel good. It's really embarrassing, though, to talk to a doctor or a therapist or even your friends about it, because nobody wants to admit they're having.
Well, and you're worried that people are going to call CPA on you or something like that, and then you can't be, true with how you're feeling, and you can't get the help you need because of that.
Mm-hmm, exactly. I think that there is that risk, and certainly people fear, my child's going to get taken away from me. They're going to call CPS because I said I'm having a thought of hurting the child. And in reality, you're not wanting to do that. It's your brain playing tricks on you. So I think that that's one sign. And I think another sign is just as women start to feel not motivated to get out of bed, like they're not finding themselves laughing with their children, or they're finding themselves constantly worried, am I doing the right thing with my child? And that worrying is getting overwhelming. The sadness, it's not even necessarily crying all the time. It's just really not feeling happy. I talk to a lot of moms who say, looking back for the last 2 or 3 years, they've got a 3-year-old. I really haven't been enjoying time with my 3-year-old. I fake it, but look, I'm not really that happy. Well, that's depression, and that's something we need to work on and do something about.
Great. Thanks, Dr. Hurst. When we come back, we'll talk about ways that you can get mentally healthy. Today on Parent Savers, we have Dr. Katie Hurst, and she's talking with us about postpartum depression. So how do you know when to get help?
As soon as you start to think, am I depressed or am I anxious? I really think that is the time when you should start asking around for help. Because when that thought crosses your mind, that means that something triggered it. And I think I see too many women in my practice who have had that thought and that just kind of brushed aside. Like, no, that doesn't happen to me. I'm not the kind of person who gets postpartum depression. Because the reality is that women from all walks of life get depressed or get anxious after having children, anywhere from immediately after they had their child, during pregnancy, like we talked about earlier, or 3 years postpartum. So I think if you have that thought of, is something wrong, I don't feel good, that's the time, really.
And Casey, you mentioned that you didn't really feel like you had any symptoms in the beginning other than the trauma. And then when your son was around 15, 22 months old, you started to experience those. I think a lot of times parents in the beginning, so much of your mental energy is devoted to like the survival, like the daily stuff, that there's not really room for those kinds of things to seep in. But then once your child gets past that first year mark, things kind of settle into more of a routine. And then that's when a lot of moms start to realize, I'm not happy. Okay, he's sleeping through the night now,
and I'm still not happy.
Right, and
exactly.
I'm still not happy.
Or we keep on saying, oh, it's, I'll be so much better once he's sleeping. I'll feel so much better once breastfeeding's working out okay, or once this and this. And once you find yourself making those deals with yourself, like, oh, it's going to be so much better when this happens. Again, I think that if you find yourself making that deal of, I'll do something if it's still this bad, then again, that's the time.
So what is recommended if you feel like you need help and you go in for help? Are you talking about medication, talk therapies, what kinds of things?
Well, I think that a lot of times women think that if they go in and ask for help with depression or anxiety, they're going to just get told, take Zoloft, and that's it. And I think that keeps a lot of women from asking for help. Because if you think you're just going to get offered a medication, and most women that I see end up in my office and are terrified, then I'm going to tell them all you can do is take medication. And the truth is that that's not all you can do. And especially if you get help sooner rather than later, you can make those lifestyle changes, I think, that are going to help you get better faster, hopefully without medicine.
So what kind of changes, do you make?
Well, I think a lot of this is about taking care of yourself as a mother. If we're catching things early, oftentimes some of these things are precipitated by moms not having any time for themselves. And I know this is, your listeners are going to laugh because they're like, yeah, whatever. Time for myself. And I can laugh in my personal life.
Shower in peace? What's that mean?
But I really do think that this is when something like this is starting. I will have parents come in together. So the mom and the partner, husband, whatever, come in and say, okay, I'm going to write you a prescription for 1 hour, 3 times a week of alone time. And the mom usually looks at me like, what are you talking about, this alone time? But it's really about actually starting to recognize yourself as a woman, apart from being a mother and a wife. And, if you work outside the house, that position. So the first step is to really start recognizing, okay, wait, I'm a person. I'm not just a mother. I'm not just, a uterus and a breasts and all that. I need to take time off to myself. So it's exercise or yoga. It's having time to meet with friends and then being honest with those friends, having a really honest conversation with women about how hard parenting is, especially in the first few years. And so that's, I think, that kind of early self-care that, like you said, Casey, earlier, can really stop these things from getting worse.
It's interesting because you said an hour to yourself, and I would love 5, really.
Usually I say 3 hours 3 times a week, and they look at me like that's not going to happen.
Yeah, my kids are right outside the door.
Right? So I start negotiating down.
Well, no, it's because it's funny because my husband, he's working and I'm home with my son, and he'll be like, I was at work all week and the weekend I want to go for a surf. And my husband's a great helper and everything else, and he does. And he's like, when do I get my time to go for a surf and be with him? And I'm like, when do I get my time? Because he's doing all the other stuff. And so he goes, well, you went to Pilates? I'm like, you kidding me? That I didn't want to go to Pilates. I did, but I did not. I'd rather do something else. I'm working. That's not fun.
Yeah.
Well, not to say I like Pilates. It is fun. So, whatever.
You're losing all your Pilates sponsors now.
I know, exactly.
Your Pilates instructor is going to make it really hard for you.
But you know what I mean. It's like really an hour to exercise. Okay, fine. You're exercising and it's surfing. But that's
different.
Totally different.
I've known a lot of moms who were kind of had the opposite, where they were afraid to seek treatment because they didn't want to take time away from their little ones
to do counseling
to go do counseling, or they're afraid they're going to tell them. Just like I've heard so many people, when I had my first baby, I had a pediatrician who every appointment would harp on my husband and I about taking a date night. Like that was the solution to every problem.
Well, and so I think you bring up a good point that I don't want to simplify things. We're talking about when you're having early symptoms, and even with the women who I'm seeing who are the most severe in their symptoms, that is still a core part of the treatment. And I'm cringing over here because I do think date nights are really important. But you're right, that's not going to solve everything.
And they are important for a lot of people. They do help. I just want moms to know that there's not really a one size fits all.
Absolutely.
Take time on your own, have a date night, all that kind of stuff will fix it. Because for a lot of moms, that doesn't fix it, and for some that could even make it worse. I think if you kind of have your own identity good and set and you're content with that and you're having a lot of trouble bonding with your baby and that's really giving you a lot of depression, then a treatment that kind of focuses on helping you with that would be more beneficial.
And that's totally perfect. Absolutely. And so you bring up a good point, and you're right. So that's where I think seeing somebody who has some specialty knowledge in this area is really helpful, because you're right. If you're having trouble bonding with your baby and that's the source of depression, then seeing a therapist who has specialty in early childhood years is going to be the thing that's most helpful. And in that case, it's bringing your baby with you and learning how to respond to him or her with the right cues and become the mother that you want to be. So you're right. It is very different. And I think for a lot of women, it is actually it comes down to taking time away for themselves. But for a lot of women, for the same number of women, maybe it doesn't. And I think that's where, if it's more severe, we certainly do get into the self-care, but we have to also look at counseling, which is absolutely the most basic treatment form. And when I say most basic, I mean most important. Like, it is the foundation for treatment for depression and anxiety. Zoloft is not going to be the solution. And I see a lot of moms, or I know a lot of moms, who don't even make it to my office because they're too scared of taking meds, and for good reason. Mm-hmm. Psychiatry does not have a great reputation, and I might get slammed by my colleagues for saying that. But I say it to my patients all the time. Like, I get it. Psychiatry is not the end-all be-all, for sure. And so therapy, though, is so important. And so finding somebody that you can really talk to and who has some skills in working out the different issues that come with being a mom, whether it's your first child or your fourth child, and how that relates to depression and anxiety for you.
Particularly in the postpartum period, because you can be so isolated. I think talk therapy is so valuable and so effective, because maybe you were working full-time in an office full of 200 people every single day all day long, and now all of a sudden, bam, like, not only are you having the hormonal changes and trying to get to know yourself as a mom and trying to get to know this baby and trying to bond with this baby, but also you have no one to talk to all day long, every day, day after day.
Absolutely. And that's where support groups and group treatment can come in. And that's actually one of the very well-proven forms of treatment. So there's individual therapy. I often recommend that women go to support groups. And we're lucky here in San Diego, we have a lot of support groups around town. But it's so hard for women to get out to a support group. There's the anxiety of wanting to talk about this with other women. And then there's just, I have to be somewhere with my baby at 10 a.m. Are you kidding me? That's way too much pressure.
Yeah. So after I had my first son, I mean, the kind of that negative voice that you were talking about was really sneaky, and I didn't really realize what it was, until I just kind of found myself crying alone in the dark, it's hearing things like, he doesn't love me, which, like, on one hand I knew, like, that's ridiculous. You are all he knows of love, but then at the same time, like, kind of that negative voice. I didn't end up needing medication for it. It kind of, after some time passed and being aware of it and doing my own self-care, kind of the fog lifted. But I know in some situations, medication really can be helpful in that it can get you to the point where you are able to really do the talk therapy and access kind of your rational and emotional self to bond with your baby. Has that been your experience as well?
And absolutely. I know that I've talked, kind of negatively about medicines earlier in the program, but in the end, I think medicines can really be lifesavers, and for a lot of women who are going through this kind of experience. When we look at the medication like Zoloft and the medicines in that class, Prozac, things like that, that class of medicine has actually had more data. It's been studied more than any other class of medicine in pregnancy, including like the medicines, that we get to stop labor, things like that. So we've got a lot of data on these medicines for pregnancy, and we've also got a lot of data on them in breastfeeding. And so when women are so terrified to take medicines, especially if they're pregnant or breastfeeding, I think it's really important to know where you can go to get real information about them, because if you just Google medication in pregnancy, you're only going to find horror stories and really negative things. And the other thing I think is to know that, like you said, for some women, they can't engage in therapy because they're so depressed or
if
so
you can't
anxious.
get out of bed, and you can't make it out the door,
or they're so anxious that they can't stop that anxious thought, and so they can't even start to work with the therapist on how to talk back to the negative thoughts or the anxious thoughts. And so that's where medication can be really helpful. If you need to get out of bed, if you can't even get to talking back to the worries, because the worry is so profound, and I talk about hamster wheels in the brain. Women have 20 hamster wheels going, and you can't stop one of them if you are so overwhelmed by the worrying that's going on. So that's where medicine can really play a role.
Thank you so much for Dr. Hurst for helping us learn about postpartum depression and how it affects us and our families. Please reach out if this episode hit home with you today. You can contact the Postpartum Support International at postpartum.net. Click on the link, Get Help. If you want more information on Dr. Hurst, go to today's show on our episodes page on our website. We have a message from one of our listeners. Joy on our Facebook page writes, I listened to the traumatic birth episode the other day while on a walk. I have an 18-month-old. Most of our birth-related trauma came with the decision to have a planned C-section due to a previous uterine surgery that gave me a heightened chance of uterine rupture. We really wanted to have a natural birth, but that won't ever happen for us. Still, the birth was the best day of my life, thankfully. This episode has really brought me back to thinking about that time and dealing with the loss I feel over never having the opportunity to have a birth that I'd like. Thanks so much for the panelists for sharing their stories. I'm loving the show so far, so keep it up. Thank you, Joy. We love to hear from you guys. If you have a question, comment, or suggestion, send them our way. You can message us on Facebook or our website, parentsavers.com. That wraps up today's episode. We'd love to hear from you. If you have a question for our expert about today's show or the topics we discussed, call our Parent Savers hotline at 619-866-4775 or send us an email through our website, parentsavers.com, or our Facebook page, and we'll answer your question on an upcoming episode. Coming up next week, we're continuing this discussion on postpartum depression. Did you know that dads can suffer too? We're talking with the dads next week. Thanks for listening to Parent Savers, empowering new parents everywhere.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.